All right, let's begin. Hello, everybody. Dr. Guevara here, your sciatica specialist. Today, we're talking sciatica and how to treat sciatica using a simple 7-step process without risky back surgery, painful epidural injections, or addicting painkillers. And I've been using this system for 8 years now, and it's given thousands of people great results. And I want to show you how to do the same today. Now, here's what I want for you. If you guys are paying attention on this call, if you're listening and taking action on what I'm about to show you, here's the end result. Here's what's possible for you. I want you to not have to rely on a pain pill to get through your day. I want you to be able to do the things you enjoy without pain. I want you to strengthen your body because that's what's going to help you prevent injuries and flare-ups in the future. And I just want you to live a pain-free life so that you can continue to do what you enjoy. And you're going to learn how to do that today. It's what I've been doing for the past 8 years. And if you guys listen closely and take action, this is definitely possible. Now let me give you an example of that. This is William Vest. I love showing him off and bragging about his success using the treatment plan and exercises I recommended for him. He made a commitment to follow the exercises and is now living pain-free. And what's more amazing about this is that he is 67 years old. That goes to show you if he can do it, anyone can. You put in the work just like William did. You can kick sciatica's rear end. So hopefully that excites you. Now here's what you're going to get today. This is my intention and my promise. I want to give you a simple framework for treating sciatica with home exercises because at the end of the day, nobody cares more about your body than yourself. And after training thousands of patients, I'm here to tell you that you do have options and you don't have to live with pain for the rest of your life. So by the end of this training, I want you to say, I can do this. And I want you to remember this. What you're going to learn here means nothing today if you don't implement it. We're not here just to learn, but to take daily action. That's how you're going to get the results that you want. There's no magic pill. It takes a little bit of work on your part and daily action. So I hope you guys get that. If you do, then you're in the right place. You're also in the right place if you're tired of your doctor only prescribing painkillers that only mask your pain, but don't get rid of the problem permanently. You're also in the right place if you've heard horror stories of back surgery and don't want to take the risk or spend all that money. Or perhaps you just want to avoid painful epidural injections that simply don't work and can sometimes make the pain even worse. Or maybe your back pain and sciatica keeps you from enjoying time with friends and family and you just want to get better. But I'll tell you, this training is not for everybody. First, if you're looking for a magic pill that will give you results overnight, you're probably not going to like this training. Also, getting rid of sciatica takes work, so if you don't like to take action or can't commit to a treatment plan, or if you just want the lazy approach, this is not it. Also, if you don't think you're responsible for your own health and you blame others or your genes for not being healthy, then this is definitely not for you. And if you're the type of person that gets angry or frustrated when a doctor recommends a rehabilitation program that will guide you step by step and give you results, then this training is not for you. This training is going to be jam-packed with great content and information that you can implement right away, but it will be impossible to put 8 years of experience into this short presentation. So at the end of this training, I'm going to introduce you to an opportunity to continue working with me. I have a complete 6-week program I put together where I show you step by step through online videos how I've been able to help thousands of people to get rid of sciatica naturally without surgery from the convenience of their home and help them save thousands of dollars in the process. And you're going to get a chance to see that program at the end, so please make sure you stay the entire time. Now I do have a lot to cover, but I wanted to give you a gift at the end of this presentation. This is yours absolutely free. It's my guide on how to eat to reduce pain and inflammation and relieve sciatica. This is the same workbook that I give my patients that I see at my clinic, and it teaches them what foods to eat to recover fast and also what foods to avoid so they can prevent chronic pain and inflammation. This is yours free just because you're hanging out with me, and I'll tell you where to get it, where you can get your hands on it at the end of today's call. So I hope you guys are excited. I want to jump right into this. So here's some of the stuff you're going to learn today. I have a 7-step process to identify the cause of your sciatica and how to treat it based on its cause, with the end goal being no pain, being more active, and doing the activities you love once again. I'll show you how to perform specific exercises to treat your sciatica at its source right from the comfort of your home so you can start feeling better today. And how to avoid the most common mistakes that people make that keeps them in pain for many years. Now, for those of you guys that don't know me or haven't been exposed to me yet, I gotta tell you my story and how online videos have made a difference in my life and in the lives of thousands around the world. I've been helping people with sciatica through online video programs for 8 years now. Video and the internet has helped me to reach people in other parts of the world that I would never be able to help in my local community. A video has allowed me to be in someone's iPhone or laptop in the other side of the world without having to physically be there, and people still get the same results as if they were seeing me in person. The beauty about this is that I have more time to help others because I don't have to be somewhere physically to help you out. And this is me at my office in Atlanta being interviewed by celebrity fitness trainer Marcelo Vasquez. He found my videos online and reached out to me because he saw how much value I was giving away and how many people I was helping out. And here I am today, still creating online videos and programs and helping people who are tired of being in pain and going the conventional treatment route. And I know most people who have sciatica don't like exercise videos, and most of my patients hated it initially, but after they start seeing results, they know it is essential to get rid of sciatica by attacking it at its source through exercises. Today I continue to teach people how to get out of pain, and I love doing presentations just like this one, and I appreciate you guys for being here with me today. But I want to show you how I got started with this. In 2008, I graduated from Life University in Marietta, Georgia, one of the best schools in the world in chiropractic and injuries to the spine. In February 2009, I started practicing, and I had all the best intentions to help as many people as possible in my local community. So towards the end of 2009, I started making educational videos to help local sciatica patients and attract more people into my office. And little by little, people started to notice me, and my practice was growing just from my videos online. But then I started to notice that people from out of state were calling the office because they had seen my videos. And of course, with them being out of state, it was hard for me to help them unless they flew in. And some actually did travel, but for the most part, I just referred them to doctors within their state. So I knew there was something to these videos I was posting online because they were helping people outside of my community. And then things got even more interesting. I was getting emails from people in other countries telling me how they had found my videos and they were actually feeling much better from the exercises I was sharing. Now, the reason I tell you this story is because the people that emailed and called our office kept telling us that the treatments they were going through only masked their pain temporarily, but they never got rid of the problem, or they didn't work at all. And some even went as far as having surgery, and yet they were still in a lot of pain. And they kept saying the same thing. The exercises I was posting online were working better than anything they had tried. So then a light bulb went on. So in 2010, I started doing some major research. I became obsessed and started researching relentlessly during my free time. I did hundreds of hours of research, spoke directly to people who had sciatica, studied their treatments, and even talked to other doctors who were treating these patients and tapped into their methods and why some weren't working. I learned conventional forms of treatment only gave people temporary relief, wasted a lot of their time, and cost them thousands of dollars every year. I studied why some people were still having a lot of pain even after surgery. So what I found, and you guys might relate to this, is that there are three major misconceptions that patients have about sciatica. Number one, the misconception that treating the symptoms will make your problem better. This is the classical case of going to your doctor and only being prescribed painkillers with no permanent change and a lot of side effects. Now this never works because you're not treating the source of the problem, you're just masking a symptom. And this is the reason why you continue to go back for more painkillers with the same result. Now, misconception number two is that people don't understand that back pain is a process. Most times, back pain and sciatica takes weeks or months to develop, but you're not aware of the condition until it starts to hurt. Of course, with the exception of traumatic injuries like car accidents, sciatica and back pain is rarely a one-time thing. They just don't happen overnight. For this reason, you will not heal your back pain and sciatica overnight. It takes a systematic approach with the correct treatment plan and exercises and a little bit of patience. And misconception number three is believing there are no other options but surgery. A lot of people I talked to wanted to stay away from surgery because of the risks and because of the massive expense. Back surgery can cost anywhere between $20,000 and $30,000 and does not guarantee that you'll be back to 100%. And the $20,000 to $30,000, by the way, is only for one segment. For example, if you have a disc herniation in one disc, that's $20,000 to $30,000. If you add another disc injury, then that's probably going to be at least $10,000 more. Now, many times surgeries give the patient quick relief. However, they don't fix the underlying weakness that's present in the person's back. So the chances of a reherniation or a relapse are very common. And according to the San Francisco Spine Institute, out of the 25,000 surgeries performed each year, only 10% are necessary. And you know the reason for this? Because if you go consult with a surgeon, they're going to recommend an operation. That's what happens with a lot of people. They go see a surgeon. What's he specialize in? Surgery. So there you have it. So here are some additional research that I found. Check this out. America spends more than $80 billion a year. That's with a B. Yet many specialists say less invasive treatment is actually more effective. And there's evidence that standard treatments for back pain, such as surgery, spinal injections, and painkillers, are often ineffective and can even worsen and prolong the pain. Some research even suggests that 1 in 5 patients who have back surgery end up having more surgery in the future. And there's good reason to think that we are overprescribing painkillers, overprescribing injections, and overprescribing back surgery. This was said by Dr. Richard Dio, who's an authority on evidence-based medicine. And I really made it my mission that I was going to find a way to help these people. So I took the best of what I learned and implemented, tested, tweaked, and combined it and created my own system, and I've been tweaking it ever since. And even though it took a lot of my personal time, I started making specific sciatica videos and programs, and my out-of-state patients saw success pretty quickly. I was flooded with positive comments and emails from people who were getting well and getting the results they were looking for. So fast forward to today, my videos have been viewed over 10 million times with over 54,000 people who have subscribed to my YouTube channel. And I'm really excited about that because I've been able to help thousands of people in over 180 countries thanks to the internet and my videos. And I'm not sharing those numbers to brag, I'm just sharing this with you because this confirms what my research proved. More and more people are going online every single day because their current treatments are not working and they're looking for alternative solutions. As a matter of fact, you probably landed in this presentation because you're suffering from sciatica, have tried different things with little to no relief, and saw one of my videos online. And here's more proof of this. Over 300,000 new people discover my videos every single month. Now that's a lot of people who are not getting the results they want and are looking for help somewhere else. So my videos and programs have reached thousands of people worldwide, and it's given me the ability to make a huge impact outside of my community and help more people than I thought possible. And to me, it's all about helping people. That's what's important to me, and that's the reason why I continue to practice and help others. Now, these are some of my patients that have written to me, and I get these every day. It's what drives me to keep helping more people and keep making a difference in so many lives. Now, Oyimbo said, "I can't believe how much just doing this simple exercise has relieved my lower back pain. I've been having this pain for about 3 years, seen a chiropractor, osteopath, physiotherapist, and they gave me exercises to do, but it made my pain worse. Sticking to this one stretch has greatly improved." Now, Jill Murr said, "I can't thank you enough for sharing this. I am pain-free after struggling for years. It worked almost instantly." Blue Grant said, "This helped me so much. It helped me to understand the back and the muscles and how they work. It also relieved 7 months of pain." Now, Maria said, "Thank you very much, Dr. Guevara. Your tips helped a ton in minimizing and eventually all the pain and symptoms will totally be gone." Now, this is really exciting stuff, and I want to show you how to do this, okay? So I'm going to help you guys solve some of the biggest hurdles or problems that people go through that keep them in constant pain. Problem number 1, being told you need bed rest. Have any of you been told by your doctor to stay in bed? Did it work? You probably wouldn't be here if it did. Now, it may sound counterintuitive, but exercise is actually better than bed rest for back pain and sciatica. You see, what happens is that inactivity deconditions your muscles and spinal structures and makes them weak and deprives them of necessary nutrients only provided through motion, which would lead to weak muscles, weak discs, etc., which leads to more pain. So what's the solution? Well, plain and simple, just remain active. Go out for a walk every day and modify your daily activities. The key is to keep moving. Don't be afraid of a little bit of pain. It is just part of the rehabilitation process. Motion and exercise is what nourishes and repairs injured tissues. Don't sacrifice activities that you enjoy doing. Go ahead and do them. Just modify how you do them. So let's look at the next one. Problem number 2. It's all about masking the pain and symptoms. This happens way too often. People are not treating the pain at its source. This is the single biggest reason why many people never get out of pain. What this basically means is that by taking painkillers or getting injections, you're just tricking your nervous system so that you can't feel the pain. But this gets you stuck inside what I call the endless pain cycle. This is what I mean. The sad face represents you when your sciatica flares up. So what usually happens is you take some meds and you feel happy because your pain feels better, hence the happy face. But then the meds wear off and you're back to where you started, the sad phase. You see, the vast majority of people who suffer from musculoskeletal pain are stuck in this cycle and they continue to live like this for years. Now, wouldn't you agree that if the meds were working, you wouldn't have to keep taking them? Another thing I see is that people treat their leg because they feel the pain there, but that's not where the sciatica originates. You will never get rid of sciatica by massaging your leg or using heat pads on the leg or doing anything to your leg. Sciatica originates in the spine or pelvis, so that's where you have to treat it. So listen up, this is how we solve this. You simply treat the problem at its source instead of just masking your symptoms with painkillers. Like I said, I'm going to show you how to determine what's causing your pain, and once you know this, then you treat the problem with specific exercises that attack the cause of your pain. Now, these exercises are designed to help you get rid of sciatica and to strengthen the affected areas to prevent flare-ups in the future. And problem number 3 is thinking surgery is the only answer. Now, the good thing about this problem is that most people are scared of surgery because, well, it's surgery. There's always risks involved, and nobody wants to go under the knife. So surgery should always, always, always be the last resort because research shows that less than 10% of people with back pain or sciatica actually require surgery. So basically, the odds are in your favor that you're going to get better without surgery. And even if you do have surgery, that doesn't mean that you're going to be okay right after that. As a matter of fact, I get emails every single day of people who had surgery and still have the same problem, but they're stuck with a huge hospital bill now. Just look at this message I got the other day. A lady went in for a discectomy, which is where they take out a portion of a herniated disc, and the highlighted portion here is after the surgery. She says, the pain in my left leg is 100 times worse than it was before. When I stand up, it feels like 1,000 volts of electricity are running through it. When I'm up and walking, my leg just gives out and I almost fall. I thought I would be dealing with the pain from my surgery site, but I barely notice it due to the sciatica pain I'm still dealing with, and it's so much worse than it was before. I went to sleep with everyone saying I was going to feel so much better and my leg pain should be gone. Wrong. As you see from this message, just because you have surgery doesn't mean you're going to end up 100%. So what's the solution? Try therapeutic exercises first. You'd be surprised by how many people get better by just doing a program of specific exercises. The people who get the best results are the ones that stick to a plan and do it consistently. You can't expect to do exercises one day and be fine the next. No, this takes a little bit of work and time. And unlike surgery, exercises actually strengthen your body and can prevent future flare-ups. Okay, so hopefully you guys don't have any big objections or hurdles holding you back from getting rid of sciatica. So here are the 7 steps. Are you guys ready? Okay, here we go. Step number 1, identify the cause of your sciatica. Step number 2, perform orthopedic tests to confirm your diagnosis. Step number 3, follow an exercise program that's specific to the cause of your pain. Step number 4, reevaluate your progress after you've started the exercise program. Step number 5, start the second phase of treatment. Step number 6, reevaluate your progress throughout the second phase of treatment. And step number 7, proceed to phase number 3, the final phase of treatment. Now these are the 7 steps that I use. Here they are, all right in front of you, and we're going to be going all over 7 here today, but again, we have limited time, so the ones that are starred are the ones that I feel are the most important for you guys right now. So step 1, 2, and 3, we're going to go over in much more detail on those 3. Sound good? You guys ready? Okay. But before we do that, I'm going to give you the 3 most common causes of sciatica, and we're going to apply the steps number 1, 2, and 3 to each one of these causes. Okay, so the 3 most common causes of sciatica are disc injuries, which include disc herniations and disc bulges, spinal stenosis, which is seen with arthritis and degenerative disc disease, and SI joint dysfunction, which is basically an imbalance in the pelvis or inflammation of muscles in the pelvis, which can also be called piriformis syndrome. So in order to get an accurate diagnosis, we have to go through the 3 steps that we talked about. Also, knowing a person's age is very important. So let's start with the number 1 cause of sciatica, disc herniations. So with disc herniations, you see this mostly in people under 35 years of age. And the pain increases when you're sneezing, coughing, pushing while at the bathroom, lifting heavy objects, and bending forward from the waist, or sometimes even sitting for a long period of time. Now you feel less pain when you're laying on your stomach and moving the low back into extension, which is basically the opposite of bending forward. So step number 2 is to confirm our diagnosis with orthopedic tests. So here's an easy one to identify a disc herniation. To determine if you have a disc herniation, lay flat on your back and lift your legs up 5 inches off the floor and hold that position for 10 seconds. If you feel any sharp pain in the lower back area or pain that travels down the leg, then that is an indication that you may be suffering from a disc herniation. And step number 3 is once you have confirmed the diagnosis, then you can do an exercise that's specific to treat a disc herniation like the one I show you here, the hip bridge. Here's what it looks like. To perform a hip bridge, lay flat on your back with your heels on the floor and lift your pelvis up, forming a straight line between your shoulders and your knees, and hold that position for 3 seconds. Relax and then repeat again, and you're going to repeat this exercise 20 times. Okay, so there you go. You just learned how to identify the cause of a disc herniation, how to confirm the diagnosis, and an exercise to make it better. Very simple, right? Now believe me, anyone can learn how to do this because I make it so simple to understand. So let's move on to the second most common cause of sciatica. This is spinal stenosis. So let's go ahead and find the cause of this one. Step number 1. So spinal stenosis is seen mostly in people over the age of 50. Once again, this is related to arthritis and degeneration, so think older people. Pain with spinal stenosis can increase when standing or walking for a long period of time, standing up from a seated position, and also from standing up straight. People with spinal stenosis feel less pain when seated or when bending forward from the waist. And you've probably seen elderly people that walk with a forward lean from the waist, and the reason they do this is because it hurts to stand up straight because they have spinal stenosis. Now step number 2, now we're going to confirm the cause of spinal stenosis with an orthopedic test. And here's the test. To test for spinal stenosis, you're going to stand up with your feet shoulder width apart, and you're going to lean back 5 times. If you feel an increase in pain and sciatica when you're leaning backwards, this is positive that you have spinal stenosis. Now there's 2 parts to this test. The second part, you're going to lean forward from the waist 5 times. And now in this part, if you have a decrease in pain and sciatica, this also confirms that you're suffering from spinal stenosis. Okay, so now we're on to step number 3. Once you have confirmed the cause of your problem, once you have done the orthopedic test to confirm the diagnosis, then you can do a simple exercise that's specific to treat spinal stenosis, like the knee to chest hip flexions that I'm showing you right here. To treat spinal stenosis, lay on your back and bring one leg towards your chest, holding that leg for 30 seconds. Then after 30 seconds, you're going to relax that leg and do the opposite leg. Lift the leg again, bringing your knee towards your chest, holding that position for 30 seconds. And you're going to repeat this 5 times on each leg. Okay, so now you've learned how to diagnose spinal stenosis, how to confirm that diagnosis with an orthopedic test, and an exercise to make it better. Pretty easy, right? This is exactly the same thing I do in practice and teach my patients. Alright, so let's go into the third most common cause of sciatica, SI joint dysfunction. So to diagnose this one, age does not matter because it can occur at any age. However, one major difference between this diagnosis is that the pain going down the leg does not go past the knee joint. That's very important to notice. Big difference from the other 2 conditions that can travel all the way down to your feet. Now with SI joint dysfunction, pain increases when standing or sitting for too long, and with transitional movements or moving from one position to another. So for example, when you're getting out from a bathtub, getting out from your car, or rolling over in bed, and you feel pain going down the leg but it does not go past your knee, then you may have SI joint dysfunction. So let's go on to step number 2. We're going to confirm that diagnosis with an orthopedic test just like the one I'm showing you right here. To test for SI joint dysfunction, cross the bad leg over the good one and then relax that leg. If you're feeling pain that travels down the leg but does not go past the knee joint, then that's a positive indication that you're suffering from SI joint dysfunction. And step number 3 is we're going to perform a specific exercise that will attack the cause of your pain. Now here's the exercise. To treat SI joint dysfunction, cross the bad leg over the good one and then pull that leg towards the opposite shoulder. As an example here, I'm showing the right leg being pulled towards the left shoulder. Each time you pull, you're going to hold that position for 30 seconds, and you can repeat this 5 times on the painful leg. And now we move on to step number 4. Step number 4, we're going to reevaluate your progress. How do you know you're ready to progress to different exercises once you start? Now, in treatment, you have 3 different phases of care. The goal in phase 1 of treatment is to reduce pain and inflammation so that you're able to move with less restriction. If you're treating your sciatica correctly at about 2 to 3 weeks after starting a treatment plan, your pain should be around 50% less than when you started in order to progress to the next phase of treatment. Now in step number 5, you start phase 2 of treatment. The goal is to increase movement throughout this phase. After you get through the first phase of treatment, which is for pain and inflammation, in phase 2 you're going to start doing exercises that are a bit more challenging but help to restore range of motion and strength. In step number 6, we're going to reevaluate your progress. How do you know that you're ready to progress to phase 3? Now, after about 4 to 5 weeks of treatment, your pain level should be at about a 2 on a scale of 0 to 10, with 10 being the worst pain. At this point, you should be able to perform most activities around your house with very little pain. And step number 7 is basically the third phase of treatment, the final phase, where the goals are to maximize strength and return the patient to daily activities. Now in this phase, you're going to be introduced to strengthening exercises that help you transition to daily activities, and you're going to strengthen your back to prevent future injuries and flare-ups. Okay, so I know I went really fast, so I'm going to recap these 7 steps really quickly so you guys get them all. First one is identifying the cause of your sciatica. Number 2 is you want to perform orthopedic tests to confirm that diagnosis. Number 3, perform specific exercises that attack and correct the root of your problem. Number 4, reevaluate your progress to see if you're ready to move on to the next phase of treatment. Number 5, introduce different exercises. Number 6, reevaluate again to make sure you're moving right on schedule and ready to move on to the third phase of treatment. And number 7, proceed to phase 3 with new exercises that will help you to do your daily activities without a problem and prevent flare-ups in the future. Okay, so that's the plan that will give you long-term results, and I'm assuming that's what you want to do instead of just masking your symptoms temporarily and living in pain for many years. So here are the 7 steps. I laid them all out in front of you, and I hope you guys got a lot of value out of this. Now, I'm not sure why you showed up today. Hopefully it's to learn about how to get rid of sciatica. Or maybe you're just frustrated with the way your doctor only prescribes painkillers that don't do much for you. Or you may be trying to avoid going under the knife or avoid injections that can be very costly without any guarantees. Or it could be that you just want to enjoy more time with family and friends without restrictions or complaining of pain. Or maybe you've heard of all the buzz and excitement about how others are having success with sciatica exercise programs and you wanted to see how you can make it work for you. Or perhaps you were just bored and I just wanted to hang out with me today, and if that's the case, I appreciate you spending some time with me. I appreciate that. But we can very clearly state that following a specific program with exercises works, and they can strengthen your body, get you out of pain, and transform your life. And I believe that if you've been here on this call up to this point, you have what it takes to excel at getting rid of sciatica. As long as you're willing to put in a little bit of work every single day, this is something you can get started with right now. And I want you guys to remember something. Nothing I've shared with you today is theory. I've been using this same system for 8 years now, and I've simplified it to a basic level that even a 4th grader can follow this. And it's exactly what I've used to help thousands of people all over the world to get rid of sciatica and gain their life back. It doesn't matter if you've never exercised before or if you're 70 years old. It's all about taking baby steps and taking consistent action with the right plan right now. So this is why after all these years, I'm still making programs and videos and showing people how to get rid of sciatica from the convenience of their home. So some of the big benefits of sciatica exercises are, yes, you put in the work, but they eliminate the problem at its source, so this means permanent results. They get you stronger and prevent flare-ups. You'll save thousands of dollars on painkillers, epidural injections, or even risky back surgery. You can do them anytime from the convenience of your home. You can get rid of your pain naturally without any side effects, and you're basically in control of your own health, which to me is what this is all about. So if there's one thing to take away from all of this, is that when it comes down to treating sciatica naturally, I can teach anyone how to do it through my online video program. This has literally changed the lives of thousands of my patients, and yes, this is very much a replicable system that you too can apply, as proven by a lot of my patients. And you can save a lot of money and time by skipping treatment options that only mask your pain temporarily. So the obvious question is how you can apply this system to get rid of your sciatica without spending thousands of dollars on treatments that only cover up your symptoms temporarily. Well, you have a choice. You just have to decide if you want to continue doing the same thing you've been doing, rely on painkillers that only mask your pain temporarily, or you can just let me give you the roadmap. Let me hand over the 6-week program that I use in real life practice to get rid of sciatica naturally. This is my 6-week training program that I told you I'd be introducing, the Sayonara Sciatica System. So what exactly is it? What is the Sayonara Sciatica System? It is my complete step-by-step online video sciatica program. This is 8 years of my research, knowledge, and real clinical experience all bottled in one convenient location and simple to follow action steps. It's designed to take you by the hand and attack sciatica at its source through easy to follow videos and manuals so that you can stop living in pain. Now, there's no missing steps and no confusion, and yes, it's the quickest and most effective way to get from point A to point B and get you out of pain. And the best thing about this is that you can access the whole program through any electronic device. Your cell phone, your tablet, laptop, or desktop, it doesn't matter. You can watch the training videos through there. So it's a 6-week step-by-step video training program that walks you through the 7 steps that we laid out here today, and it is broken down into 3 different phases of treatment in much more detail. Now, you're not going to find a complete 6-week program like this looking around for hours on YouTube. I can guarantee that. You get 24/7 instant and lifetime access, including updates. And I've been doing this for a long time, and I intend to do it for a long time, so I continue to study and update the program consistently. And it's literally step by step. I don't leave anything out. And it comes with a private community of other people suffering from sciatica to support you and encourage you along the way. Now, here's some of them right now, and don't worry, I'm not going to read all of these, but here are some of the results some of my patients I've gotten. One person said he guides you step by step on how to identify your problem and how to fix it. Really well illustrated and easy to follow exercises. A must. And there again is William Best, a 67-year-old who's been following my treatment plans and has been able to get out of pain at 67 years of age. Amazing. Now, David Grieve said, his exercises have helped my herniated disc pain. Thank you. Ashley said, he's a blessing of all blessings to my back and I love him. So I want you to imagine how you'll feel, not having to take pain pills every day, enjoying your favorite activities with friends and family, finally getting a full night's sleep, waking up full of energy to start your day because you weren't tossing and turning all night, being able to take a few steps without pain running down your leg, and just living like yourself again. This is the Sayonara Sciatica System. All you have to do is follow the video step by step and stay consistent with the program, and I'll be there to guide you through it. Now, here's what's inside the program. In phase 1, we're going to decrease pain and inflammation, promote healing through simple exercises, prevent loss of range of motion and strength, and get rid of the pain, numbness, and tingling going down your leg. In phase 2, I'll guide you through new exercises that will help you to restore normal range of motion, restore normal strength, and get you back to moving normally again. And in phase 3, you're going to learn new exercises that will help you to maximize strength and range of motion, get you back to doing your normal activities, and get you strong again to prevent pain and injuries from happening in the future. Now, that's a lot of stuff packed into 6 weeks, but it's my complete sciatica system. So the question is how much? How much is the Sayonara Sciatica System? Well, I'll tell you right now, if you decide to go through surgery, it's going to cost a lot of money. Surgery can cost at the very least anywhere from $20,000 to $30,000 plus hospital bills, and there's no guarantee that you're going to be back to 100%. Believe me, I get the emails every single day and see it in practice from people that have gone that route. Now, if you go through epidural injections, each one of these can cost around $3,000. Now, most time, people go through 3 of these shots, which would end up costing $9,000. And of course, the reason people go through 3 of these is because they just mask the pain. You have to keep coming back for temporary relief. Now, a 6-week treatment plan with a chiropractor or physical therapist will cost you around $1,500. And yes, that's exactly what I charge in my office, where I currently have a waiting list. So take it from me when I say that the most sound solution is to take control of your own health. You got to be able to master it yourself and learn an exercise program. This puts you in the driver's seat and gives you control, because the truth is, no one cares about your body more than yourself. And in the end, you have to take the necessary steps and have the determination to allow and assist your body to heal. So what are you guys going to be paying to get 8 years of my experience and knowledge in one program? It's not going to be $1,500, not even $1,000. And other medical colleagues suggested that I charge at least $500 for the system. But after thinking about it thoroughly, I'm not even doing that. And yes, I should probably charge more than I am, but I want to help even more people, and I want this to be a no-brainer. You can get access to the entire Sayonara Sciatica system for only $39. You pay for it one time, and then you get free updates for life. If you're really serious about getting better, jump in it right now, because I'm not sure how much longer I'm going to keep it at this low rate. But that's not all. I'm notorious for over-delivering, and I also have $800 in free bonuses. You're going to get unlimited email support from me. That's a $500 value, and you're going to get that for free. You'll get lifetime updates to the program. Medicine is always evolving, and I'm always testing and tweaking new exercises, so you'll get lifetime access to any updates. That's a $200 value, and you're going to get that for free. And you'll also get access to our private Facebook group when you can make friends, get support and motivation from other people who are in your shoes. And I'm also very active inside that group, so you can ask questions there as well. That's a $100 value, and you're going to get that for free. And yes, I've got a 30-day no questions asked money back guarantee. If you don't feel any better after 30 days of consistently taking action and following the program, and you don't feel this is the best sciatica program for you, just email my assistant Lyndon and get your money back. Plain and simple, you have 30 days. Okay, so we're going to recap everything. You're getting a complete 6-week sciatica program. You'll go through 3 different phases of care with step-by-step video tutorials, and you can view these from any electronic device. You'll get progression checklists, exercise logs, a 30-day money-back guarantee, plus 3 free bonuses. There's the link right there. It's painfreeinstitute.net/save. Okay, so listen up. Here's what I want to do now. I like to reward those who take action here with me today and are ready to finally get out of pain. Now, you might not have known me about an hour ago, but now you spent all this time learning about how to treat sciatica the right way. And if you want to take that next step and continue working with me by joining me inside the program, I want to reward you if you join within the next 15 minutes. So on top of the 3 free bonuses I mentioned earlier, I'm also going to throw in some of my best health resources so that you can feel much better than you've ever felt before. I'm going to throw in Sleep Your Way to Recovery, where I teach you the best ways to sleep so you can actually get some rest and recover faster. I'm going to throw in Ergonomics 101, where I teach you the correct way to sit, stand, and pick up objects while you're at your desk or at your job so that you're always protecting your back. And I was able to convince celebrity fitness trainer Marcelo Vasquez to throw in one of his best-selling programs, 31 days of fat-burning workouts so that you can lose a little bit of fat and gain lean muscle with easy-to-do exercises from home. And this goes hand in hand with back pain. You want to remain at a healthy weight and also maintain a lean muscle so that you're strong. Now, you're going to get all of these absolutely free when you sign up within the next 15 minutes. Now, you can't get this anywhere else. I'm not selling this anywhere else. I'm just giving it to the people that take fast action and join me inside the program in the next 15 minutes. So I'll set the timer now. There's the countdown timer at the top for those that want to get access to the bonuses. And I know I went over a lot of stuff real fast, so I'll go ahead and take some time to answer some questions, but I don't want to take up too much of your time. There's a lot of you in here, and I'll do my best to answer all of your questions. And if I don't get to your question for whatever reason, please email me. The email is help@painfreeinstitute.net. I'll repeat it again, help@painfreeinstitute.net, and I'll answer your email as soon as possible. Now, if you're ready to join us inside the program, then just go to painfreeinstitute.net/save or press the yellow button. Take advantage of the huge discount, take the amazing bonuses, and you're protected by my 100% money back guarantee. Okay, so let's take on some questions here. Here's one. Jocelyn is asking, do I need to have any weights or equipment at my house to do the exercises inside your program? Great question, Jocelyn, and the answer is no. I've made this program so that anyone can do it from anywhere without the need for any exercise bands, any weights, or any special equipment. All you're going to be using is your own body. Okay, so here's another question. Josh is asking, how many times a week do you have to do the exercises? All right, Josh, in the program, you'll be doing exercises daily. Initially, it'll be mostly stretches and easy exercises. Now, as you start to feel better and progress from one phase to another, you'll be doing more exercises, but you don't have to do them all in one sitting. You can split them up however you want throughout the day. If you want to do some in the morning and some in the afternoon or evening, that's fine. As long as you get them done in one day, But yes, to answer your questions, you're going to be doing exercises daily. Here's another question Karen is asking. I have disc herniations and my doctor recommended surgery. Can a disc heal just through exercises? Yes, Karen. Definitely. Most people, I would say about around 90% of people, or even higher, of people with herniated discs don't need surgery. There are extreme cases, of course, where that may be the only option, but for the majority of people, a specific training program with specific exercises for disc herniations can do the job. Again, the key is to follow a plan with exercises that target disc injuries and doing the exercises consistently. Let's see, okay. Oh, we have a few people that have signed up in the last few minutes. Dave Reeves, Jennifer Reiser, Lee Weisman, welcome aboard, you guys. Thanks for joining us. Okay, Jackie is asking, if we're stuck or have a question, will we have access to you? Yes, Jackie. I won't leave you hanging. I'll be emailing you. I'll be sending you an email every single week, and you'll have direct email access to me. And I'm also very active in the private Facebook group, so you can get a hold of me on there as well. So to answer your question, yes, I'm here to help you in any way I can. I also want to thank each and every one of you guys, whether you decided to take action and enroll or not. Thanks for being here and taking the time to hang out with me. And because you stuck around till the end, as I promised, I'm going to give you the report called How to Eat Your Way to Recovery. This is yours absolutely free just for hanging out with me here today. And you can download it by going to the following website. Go to painfreeinstitute.net/nutrition. I'll repeat it again, painfreeinstitute.net/nutrition. Okay, so we have a few more people that have joined us inside the members area. Jared Washington, welcome aboard, my friend. And Teresa Robinson, welcome aboard, Teresa. Okay, so here's another question. Martha is asking, I've had sciatica for years. Will this be able to help me? All right, Martha, yes. I've personally helped many people who were suffering from sciatica for years because they only kept masking their symptoms with painkillers or never attempted any other type of therapy. Once you start the program, you will feel a difference. But if you've had the problem for a long time, don't expect an overnight miracle. As long as you're consistent, putting in the work every single day, you're going to see results. So yes, even if you had the problem for years, you can see great results with the program. All right, Michelle is asking, can I continue going to the gym if I start your program? And I would say yes, you can. However, make sure whatever you're doing at the gym is not making the pain worse. It's best to heal completely before you start any gym or training program. This is the reason why inside the Sayonara Sciatica system we go through 3 different phases of care to make sure that you're progressing and improving from phase to phase and healing properly. Okay, Jackson's got a question. He is asking, I've tried exercises before and they would cause my pain to flare up. Is this something that's normal? Yes, Jackson, anytime you start an exercise program, you're going to have some soreness, and I teach you inside the program how to deal with flare-ups. The problem is that most people just find a few exercises online without knowing if they will even work for the cause of their sciatica, and they do them occasionally, but they don't follow a structured system. The best way to get results for the long term is to follow a program of exercises and move through different progressions of phases of healing. Now, inside the program, I focus on walking you through the process of identifying the cause of your pain, prescribing specific exercises, and following up with you. So there's no cookie cutter approach. You'll diagnose the cause of your pain and then know exactly which exercises are right for you. We got another question here. How much time will it take to do these exercises? Well, listen, because you're doing these at home, you're already saving time by not having to drive to a clinic 3 times a week. Now, depending on what phase of treatment you're in, you can expect to spend, I would say, 30 minutes a day. But remember, you don't have to do all these exercises in one sitting. You can split them out throughout the day to fit whatever time frame you have. Now, when you think about how much sleep you're losing because of the pain, the amount of time it takes you to do these exercises is definitely worth it, and you can even do them while you're at home watching TV. All right, next question. What if I can't afford a program? Okay, I understand money's tight for a lot of people, and this is why I brought down the price. Now, that's the lowest I can set the price because I do have staff I have to pay to run this program, and I'm confident you will not get the same results for less anywhere else. I mean, just look at your other options. Surgery is at the very least $30,000. Epidural injections, a series of 3 injections is $9,000 now. And paying out of pocket for 6 weeks to a chiropractor or physical therapist is going to cost you $1,500. So as it is, the program is a steal, and you're not going to find a program of this quality at this price anywhere else online. Okay, another question is, I live outside the US. How can I purchase the program? Alright, so the program is an online video program, which means as long as you have internet access, you can follow the program anywhere in the world. It can be watched on your computer, your laptop, tablet, or even a smartphone. So, it's an online-based program. You can see it anywhere you have internet access. Okay, alright guys, well listen, I love helping people and this was really fun for me. I hope you guys got a lot of value, learned something, and my best advice for you is to do something today with what you have learned here. Take action. Write down at least one thing you can do in the next 24 hours and take action on it. Avoid activities that make the pain worse. Practice the exercises I showed you here today and just do something. Get moving in the right direction so that you can get out of pain, okay? Now before I let you guys out of here, if you have any questions I didn't get to answer, please type them in the comments section or email me at help@painfreeinstitute.net. That's help@painfreeinstitute.net. I'm always looking for ways to help more people, and I appreciate you guys spending time here with me today and the kind feedback that you've been providing. And remember, if you want to join me inside the Sayonara Sciatica system, make sure you go to painfreeinstitute.net/save. Thank you so much for sticking around here, and I will talk to you soon.